It's not just because of the temperature that I get chills when I see that, because I do. Every time I think about what the potential is for us as a community and how that facility looks, it reminds me of the importance of the communication, the conversations that we've had with this community as we've begun building this facility. Everything that we heard from you as a community is in that hospital. We heard, hey, we want a 24-hour ED. It's there. You saw it in there. We want a pharmacy that we can access on a regular basis. It's there. You said we want nice patient rooms that look out to the outside and have green space. It's there. We said we want a community room where we can gather and make this a place to congregate and talk about the issues that face our community and talk about wellness. You saw it. It's there. You saw the open space when you first walk in the facility. We heard that over and over again. Make it a welcoming facility that literally puts its arms out to us and welcomes everyone in the community to it. So this, to me, is a wonderful thing, a wonderful time for us to celebrate. Yes, I'm going to say it, and you're going to applaud. The first hospital built west of 9th Street in Louisville, Kentucky in 150 years. I might say that again a time or two before the day is over. Everything we do at Norton Healthcare has to do with how we view our mission, how we see the vision for our community, and how we regard our values. There was a day in the conference room at Simmons College. I had a conversation with Dr. Cosby, sitting in his conference room at Simmons. And I said, things have got to change. We've got to do a better job in healthcare. We've got to make things better and different. And he stopped me. And he said, and I remember it to this day, he said, if you want to make a difference, you must plant your mailbox in concrete in this community. So Dr. Cosby, 850 South 28th Street, our mailbox in concrete. Thank you. Thank you so much for bringing that to light. I've used that story many times. And we talked about how things needed to change, and we talked about the necessity for a continuation of a vision around access, around equity, but also around permanence. For so long in Louisville, we've regarded healthcare in West Louisville with wheels. It rolls in and it rolls out, and that's fine. There's nothing wrong with that. It provides services that are needed, but we need permanence. And we talked about how this vision would create permanence. So what we are seeing today is this ceremonial manifestation that we're making progress with that beam that you're going to see go up there in just a few minutes that creates a deliverance of a promise that we made. And we recognize in Louisville that many promises have been made in West Louisville that haven't come to fruition. This one is. This hospital is being built. This hospital will be open really soon. See, Corinne's has trained me well. I used to say like September next year. She said, stop that. It's not that. This is when I'm going to preach a little bit, but not nearly as good as those that are in the audience, but I'm going to preach a little bit. What we're doing here is about leveling a playing field. Where we started was with leveling a playing field because we haven't had a level playing field as it relates to healthcare in Louisville, Kentucky in forever. Just think about this if you would. Statistically, 2 zip codes, 12 miles apart, life expectancy, a decade different. A decade different. If you live in this zip code, your life expectancy is 70 years old. If you live in this zip code, it's 80 years old. We're in a place, we're in a community where your zip code is more of a determinant than your genetic code. But at Norton Healthcare, we're going to take responsibility for changing both of those and making a difference and making it happen. It's very important that we look at that. This is about leveling a playing field that has not been leveled to this point. And I want to tell you this. Where we came from in this hospital is West Louisville deserves a darn hospital. You can clap. It's okay. It's deserved. West Louisville deserves health care that is for everyone. Access, just like the rest of the community has access to health care, West Louisville deserves that. West Louisville deserves health care that can be trusted. And that's important. That's one of the things that we are absolutely going to bring. I told the governor and I told the mayor, no one else in the country is doing what we're doing right here in Louisville, Kentucky, in this neighborhood. Nobody else. We're doing something that nobody else has done. We're coming into a very underserved area, an area that has lacked access. We're investing close to $100 million and saying we're going to change this and make a difference. So nobody else is doing it, but they're going to do it soon because they're going to see how well this is going to work and they're going to see what a difference it can make. And one of the things that they're going to find out when they talk to us after it is so successful in making the difference that we hope, we're going to talk about what made it work for us. And the first thing we're going to say is our partnerships. Because we could not do this alone at Norton Healthcare. It becomes exponential what we're able to accomplish when we work with others in the community. How about Goodwill? Folks from Goodwill, where are you? Why is it that everybody I mentioned from the podium is in the very back of the tent? Renee, we've got to fix this. Devon, you're here. I see you back there. We would not be here without Goodwill. What great partners to let us change and create this corner of hope at 28th and Broadway. Their building is spectacular. Their partnership is spectacular. Their mission is absolutely the same as ours, to make a difference, so we appreciate them. How about the Urban League? Louisville Urban League. Standing up for people in our community for years, making a difference, showing us a way to make a difference through COVID. We're so proud of the partnership, and what they've been able to help us with workforce here is just absolutely incredible. How about, let's talk for a second about Simmons College. A great partner, another great partner. We're going to be able to provide educational opportunities for people in this facility that have never existed before. As a matter of fact, we're already getting calls from other states saying, we'd like to have some residents come see what you're doing in that hospital there. So we are going to be able to take that relationship and train the next generation of physicians, yes, physicians and nurses, and everyone else that becomes so important to what we're doing here. So a tremendous relationship. We've got a great relationship with Bates. We've got a great relationship with so many other people. And by the way, my dear friend Sadiqa, where are you? There you are, dear. Sadiqa, stand up. Let's give you a round of applause. Sadiqa, Norton Healthcare is way bigger than me, but I will tell you, I don't know that this hospital is built without the relationship that I have with you. Your vision of what Norton Healthcare Sports and Learning Center turned out to be gave us the strength, the wherewithal to say we can do that too. We can build something that's never been built before and make a difference in the community. So thank you so much for all you've done. Renee, I'm hurrying. So there's a lot of people who think, oh, this is the first access that Norton Healthcare has provided in West Louisville. That's not true. For the last 5 to 7 years, we've been working very hard at providing access in this community. You might see us with another partner, YMCA, at 18th and Broadway. Thank you, YMCA, for allowing us to be in your building. We have a great partnership with 7 counties at 22nd and Broadway, where we're able to provide services there. So the folks from 7 counties, thank you so much as well. So as you can see, we don't do anything singularly or alone, and we recognize that the power of partnership, the power of collaboration, and the power of doing things for the right reasons is where you make a difference. You would expect me to also have learned something along the way in this process, and I have. And one of the things I've learned is the importance of economic development and economic revival in West Louisville. It's so important. And I do learn. You remember I talked about life expectancy being 70 years in one part of the county and 80 in the other. Well, let's talk about economics too. Median income, where you live a decade longer, is about $80,000 a year. Median income, where you lose a decade by your zip code, is $25,000. We're bringing 200 jobs to West Louisville that are going to pay on an average of about $60,000 to $65,000 each. It's a beginning, and it's only a beginning. If we allow it to be enough, we'll fail. We will continue to grow. We're committed to continue to grow. We're continue to do things the right way. We're an organization that understands growth. We're an organization that understands the importance of not sitting still. 5 short years ago, Norton Healthcare had 14,000 employees. Today, 22,000 employees. What we must do now is apply that rigor, that enthusiasm, that commitment to growing and participating in the economy of West Louisville, because that's how we change the game. That's how we change the narrative. The presence of this facility alone is going to lead to other people wanting to be here, wanting to be a part of this excitement. It absolutely has to be that way. So we're going to grow at Norton Healthcare by following our guiding principles, because we're going to believe in the possibilities of what can be. That's an important part of looking forward. And we're going to have a willingness to focus on doing the right thing, but doing it the right way. I speak of that because those 200 jobs that I told you about, they'll be here when the hospital opens sometime soon. But I want to tell you about jobs that you're seeing right now here that have been created. And by the way, we've been an organization that from day one said we're doing it the right way. We want everyone to have opportunity to participate in the construction of what will turn out to be one of the most important facilities in Louisville's history. We want everyone to be, and we've had record numbers of minority participation. We've also had participation by women and veterans in such a way that we're proud. We were pushed a little bit about what's your number going to be, and I said, I'll tell you what our number is going to be. It's going to be as many as possible. We're not going to train ourselves down. We're going to train ourselves up. Growing the right way is something that everyone understands, nobody more so than the governor of our state. This vision of this hospital, we developed in a short time ago, just years ago. I called the governor and said, need to talk to you about something. I know you're busy with this COVID thing. And what I should say is he and I were basically talking every day anyway, because he was wonderful during this time, as he is all the time. But I said, I need to talk to you about an idea. I've talked with a lot of leaders in West Louisville, and I think we've got something. He said, I'm pretty busy this week, but I can meet you anywhere you want to meet Saturday morning at 8 o'clock. Okay. So we met in the conference room at 18th and Broadway, which was a room about as big as this stage. The two of us couldn't figure out how to make the coffee maker work, so we drank cold coffee. I started telling the governor this story, what we wanted to accomplish and why we wanted to accomplish it. He let me go for about 2 minutes, and he said, stop. It's got to happen. Just tell me what you need from me.
What an incredible day. Here we are, I think, for the third time, from the announcement to the groundbreaking to the beam placement, celebrating an incredible project. But I think you celebrate what you prioritize. And today we are showing how we prioritize bringing first-class health care. You all saw that video, a top-end facility. Not any corners cut, but the very best for West Louisville is what's being built right here. This is a great moment, and this community deserves great days. And I'm glad that we've had at least 2 great days in a row. Just yesterday, I was in West Louisville to announce what we believe is the biggest jobs announcement, at least in the past 20 years, that Stellar Snacks is investing $137 million in creating 350 full-time jobs in West Louisville. You add that to what's being done here, and I think Russ is right. Who knows if we would have made that announcement without this announcement? And we are talking about 600 new jobs in West Louisville. And I know we say it over and over, but the first hospital in West Louisville in 150 years. It took too long, but we'll never have to say that again once these doors open. And I know it's not just a new hospital. Because it will be the newest, it will be the most sophisticated that Norton has ever built. The healthcare heroes at Norton and our other systems helped us get through a 1 in every 100-year pandemic. They saved thousands of lives. Listen, I'm willing to say it, that pandemic was real, and I'm grateful for everybody who helped us get through it. And they didn't just stop there. Now, they're looking for how we can get healthier, how we can improve people's lives, having made it through something that tried to take our life, how we can make life better for each and every family here in Kentucky. And I know that they're moving as fast as they can to get this facility open, knowing what it means. Today's ceremony gets us one step closer. Closer to this hospital saving lives, closer to better access where you never have to take 2 buses or drive 2 hours to get the care that you need, closer to these jobs being right here, closer to all the resources and opportunities that this hospital is going to bring. This wouldn't be possible without so many people working hard to make this project a reality. Can we get a round of applause for the construction and design team that are getting this done? And then there are the entrepreneurs, like Portia Shoulders. She started her own sanitation business. Now she's supporting the construction of this hospital. That means she's had a chance to launch her business in the neighborhood she calls home. And she knows her work is going to help patients here, going to help her create even more jobs, going to help her grow in that type of inclusion that this construction project truly represents. Can we get a big round of applause for Portia and her work? And of course, this hospital is going to be located on Goodwill's Opportunity Campus. That means folks are going to have wraparound services and top-tier medical help all in one place. It is amazing to see what these two partners, Norton and Goodwill, and how they have joined forces to truly change people's lives. And I know they didn't do it alone. They reached out to this community, to its leadership, and everyone worked together to build a better Kentucky and a better West Louisville. You aren't just talking about it, you're living your faith and values, and you are getting the job done. Real progress, big things, right here in this community. Folks, I believe that healthcare is a basic human right. And today, we're making sure we're providing that right to every human here in the Commonwealth. We think about what it'll mean in terms of people living longer, being healthier, more opportunities to be with your family and make those incredible, special moments. And my administration will continue to work to expand healthcare and never contract it, never rip it away from people who need it. And knowing that if we're going to get people back in the workforce, they got to be healthy enough to get back in the workforce. You don't help people by tearing away their health care. I'm excited to see a Kentucky economy on fire, and now seeing it come to every part of Kentucky and every neighborhood in this city. I think about 900 new expansion and relocation projects since I've become governor, a record $27.5 billion invested in us in Kentucky, and the creation of over 48,000 new good-paying jobs. I think about this project and the one we announced yesterday, meaning we're truly bringing it everywhere. I think about the expansion of Waterfront Park to West Louisville, ensuring that project reaches all of Kentucky. I think about the federal grants that are going to help Simmons get out in the community and spread digital literacy all over these neighborhoods to help as we provide high-speed internet access to every home and every business across Kentucky. That is coming with the funding that's coming down from the federal government. I think about reopening ElderServe. Tim, thank you for all the work you're doing for our seniors. I think about the project we announced with MSD, that huge Patty Run flood pump station to prevent flooding for nearly 63,000 people in this community. It's going to create about 500 new jobs. Councilwoman, congratulations on that big project in your district. And I think about the Everybody Counts program that we are all working towards. That big idea that we don't lose one single graduating senior in JCPS. That with the help of Evolve 502 that does an incredible job, we get more people in higher education with the dollars they need, but for those that want to go into the workforce, we find them a job before they graduate. Yes, it's a big idea, and it's a big goal to work for, but think if 1, 2, or 3 generations, we don't lose one graduating 17 or 18-year-old and what we can do for the entire Commonwealth of Kentucky. Today is a good day to be governor. And today's also a good day to be a dad, knowing that we are truly making sure that we're creating a better Kentucky for every generation that follows us. I think about where we are right now on a win streak the likes of which we have never seen and what it can mean. It can mean we can turn our brain drain into a brain gain and leave a collective legacy of more opportunity for all of our kids and grandkids than many of us ever dreamed was possible. Scripture tells us to do justly, love mercy, and to walk humbly with thy God. The doctors, nurses, staff, and volunteers at Norton West Louisville Hospital are going to lift up this community with love, with compassion, with empathy, with hard work, with opportunity. This is a special day. Yesterday was a special day. Let's all work hard to make sure we have dozens upon dozens upon dozens of special days ahead of us. God bless. Thank you all very much.
Wish you were a little more enthusiastic. Pretty good day to be Lieutenant Governor too. How about Jacqueline Coleman? Please stand and let us recognize you. Thank you for being here with us. And so many people are here with us today, elected officials. I can't tell you how much we appreciate it. I've had an opportunity on Sunday night at the Yearlings Club to visit with Senator Neal, who can't be here today, but he's been so supportive of this. And I'd just like to ask everybody, anybody else, elected officials, please stand and let us recognize you and thank you for your part in making this a wonderful day. You know, I like that phrase, it's a pretty good day. It's a pretty good day to be mayor, too. I will tell you that Mayor Craig Greenberg, from the very beginning, as he was even considering being mayor of the city, was in constant communication with me about what we were doing, how we could work together. If anybody has ever lit the fire on collaboration, it's this mayor. He values collaboration. He values people working together. He's encouraged us to do that. He's encouraged others to do that. He sees the value that we do in working together. The enthusiasm, the energy, and the support that he's providing us on a daily basis is another factor that's going to make Norton West Louisville Hospital successful.
It is great to be here. It's great to be here with Councilwoman Hawkins, State Representatives Chester Burton and Keturah Herron, as Russ just mentioned, and to everyone else. Because in addition to collaboration, I also greatly understand the power of momentum. And what we're seeing here today, as the governor just described, the Commonwealth of Kentucky is on a roll thanks to the leadership of Governor Beshear and Lieutenant Governor Coleman, and the city of Louisville is on a roll. You heard about this great announcement yesterday with Stellar Snacks. You're seeing another amazing project come to life here today. And so this is an incredibly exciting day for West Louisville, but for all of Louisville as we get closer to the opening of Norton West Louisville Hospital. It is going to do so much for West Louisville and our entire city and state. Of course, it's going to provide great care just as every Norton Healthcare facility and Norton Healthcare provider does. And it's going to help address those challenges that Russ was talking about that are really so unfair to people who are born into different parts of our city, to give more people easier access to not just healthcare, but the best healthcare available in the city, in the state, anywhere in the country. And that would be enough. But this project means so much more than that, because as you've heard about today, it is going to anchor this corner of West Louisville, along with Goodwill Industries Opportunity Campus here at 28th and Broadway, creating so many jobs and showing folks about the importance of attracting investment and improving the quality of life for other people, and improving the quality of life in neighborhoods all across this city. When we open the doors, and pretty soon, Russ, on this facility, it is going to be a wonderful symbol of the transformation that is beginning to take place in West Louisville and in other parts of our city, as we go from disinvestment to reinvestment. When you think about what has already been done and what has led the way, projects like the Norton Healthcare Sports and Learning Center, the new Phase 4 of Beecher Terrace that we just announced, what's going up here at 28th and Broadway between these two projects is great evidence that we can do big things in Louisville. We can do amazing things in West Louisville because you are seeing them happen right here, right now. And the way we're doing this is by working together. As Russ said, I'm a huge believer in collaboration. These projects only get done with great public, private, nonprofit partnerships to make things happen. By working together, talking, listening, addressing the real challenge ahead of us, and finding the resources to get things done to make great visions like this a reality. So now, as we celebrate the great progress that this project is making, I challenge all of us here today and everyone across our city to take this energy, to take this momentum, to take these partnerships that made this project happen, and let's create these transformations and focus on the other challenges and opportunities ahead of us right now in West Louisville and across our entire city. It's time now to take on the related crises of homelessness and affordable housing. It's time, yes, it's time to become a national leader in sustainability for everyone to see. It's time to build an economy that will attract and keep talented people in every part of our city and create economic opportunities in every zip code, every neighborhood, every Metro Council district. It's time to work with Governor Beshear and Lieutenant Governor Coleman to make high-quality pre-K education a reality for every 3- and 4-year-old child across our entire city and state. And it's time for us all to work together, to work with the General Assembly in Frankfurt, to work with the United States Congress, to find partnerships to make things that have never been possible in Louisville possible, to make more visions realities, to invest in more transformational projects for our city and for our state. And finally, and I know we have the support of Norton Healthcare in this one, it is past time to do what it takes to end the epidemic of gun violence that is plaguing our city. And I know that this project, as we focus on public health broadly, will help do just that. All of that and more is ahead of us. And I am so confident that when you see folks gathering here today to celebrate progress and celebrate success, we can certainly make more great things like this happen. So let's keep working, let's keep talking, let's keep building, and let's capitalize on this amazing momentum that Norton Healthcare is creating here in West Louisville for our entire city and state.
You know, it's easy for us sometimes to think what we've done at Norton Healthcare. There's a lot of people who have been delivering healthcare for this community and this part of the community for a long time. And they're the wonderful people who are in the family health centers, the federally qualified health centers, that have been doing this for a long time. We absolutely appreciate the great work. You are the pioneers. We look so forward to working with you. Those of you who are here, I saw Dr. Jett, others, would you please stand? There you are, again, in the back of the tent. If you all would please stand, let us recognize you for the great work that you've done. It's part of that network that we have to work together to make the difference. And it will happen, and it just needs to continue with this momentum that we talked about. There's only one person in this crowd who wants this facility to open sooner than I, and it's the chair of our Board of Trustees, Edie Nixon. And I will guarantee you that she represents an enthusiasm and eagerness for this facility to begin its work and to get it done. We also have other members of the Norton Healthcare Board of Trustees. I'd like to ask you to stand, if you would. Thank you for being here today. Wade. So this is my boss. Act like you like me. Please join me in welcoming the chair of the Board of Trustees for Norton Healthcare, Ms. Edie Nixon.
Thank you, Russ, and thank you all for being here. This is a historic day and certainly an exciting one for the Norton Healthcare Board of Trustees and for our community. I was with you at the same location about a year ago for groundbreaking, and now we see how far we come and something that I will never forget. And soon we'll be cutting the ribbon. The year ahead is going to be even more impressive as Norton West Louisville Hospital is completed. Today, we celebrate all that this project symbolizes: inclusion, hope, and access. Over the years, Norton Healthcare has made a deliberate effort to connect with people where they are. For so long, healthcare has operated from a place of asking people to come to us instead of us going to them. That's changed now, and this is another great example of what can be accomplished when you push for the possible. When there is access to healthcare, there's access to hope. Lives are changed when health issues can be addressed right away instead of when someone is in a crisis. Norton Healthcare is proud to partner with great organizations like Goodwill Industries to address the needs of the community. Norton Healthcare is happy to have a permanent location for care that meets the needs of residents here at 28th and Broadway. Access unlocks all opportunities. We believe that the access created by Norton West Louisville Hospital will lead to healing, help, and hope.
There's one job qualification that's at the top of every page at Norton Healthcare. It's a big heart. It doesn't matter what your competencies are. If you don't have a big heart, we don't want you working here. I speak often about great human interactions. Every interaction needs to be a great one. It has to be the best that it can possibly be. It has to be respectful. It has to be honoring where people come from. We're going to have so many great human interactions in this facility, just like we do throughout Norton Healthcare. But that qualification for a heart first was the first thing that drew me to Corinza Townsend as the leader of this facility. If you know her at all, you know the first thing about her is she cares. She's a great mother. She's a great coworker. She's a great ambassador. She's a great human being with a great heart. She has great passion. So much passion that she waited outside the men's restroom to stop me, along with her friend, Kirsty Matzik, is Kirsty here today? Another friend of hers stopped me and said, we have some ideas about what we can do in West Louisville. That gave birth to the Unity Jam, but it didn't stop there. Corinza wouldn't let it rest and said, we need to build a hospital in West Louisville. And so when we got this approved, when we decided what we were going to do, I said, you're so smart, we're going to let you run it. And run it she has. The enthusiasm, the wondrous commitment to mission, vision, values, the reverence to our faith history, and that heart. Please join me in welcoming a great leader, a great human being with a great heart, the Chief Administrative Officer of Norton West Louisville Hospital, Corinza Townsend.
Good morning, good morning. He spoke about everything but my leadership skills. I just want to point out that when the CEO of Norton Healthcare, the governor, and the mayor all follow directions and say soon and not give a date, you're doing a pretty good job. To answer that question, November 2024, we're gonna give it a date. November 2024 is when this hospital is supposed to open, is going to open. We talk about the construction, we talk about the jobs that are coming. We're talking about everything that comes to that brings this together. Also want to tell you what's going to happen inside this facility. So you guys have heard me mention this before, but I'm super excited to tell you that this is a full-blown hospital. It's a 24-hour facility. So you have 24-hour emergency care, you have inpatient care, you have imaging like CT, MRI, X-ray, you have a lab, you have outpacing pharmacy, you have an inpatient pharmacy, all the things that the rest of our Norton Healthcare facilities offer. And so although it's a beautiful facility, it also offers everything that we incorporate in our other hospitals. West Louisville is deserving of that, right? Yes. And to add to that, we also made sure that you had outpatient services as well, meaning there's a doctor's office that is centralized right in the middle of this hospital. So you can have your women's services, which is obstetrics and gynecology, cardiology, orthopedics. We'll do some mental health. We'll be able to take care of your diabetes. We'll be able to take care of your high blood pressure. We'll be able to take care of your pediatric asthma, sickle cell, all of the things. Again, things that we can do at our other Norton Healthcare facilities. I put emphasis on that because West Louisville is just as deserving. With that being said, you guys saw the video, so you get to see what it's going to look like on the inside. I welcome everybody when this facility opens to come. Whether you need help, whether you don't need help, come have a cup of coffee with me, come hang out in our bistro, come use our community room. This is community-centric, and I just want to make sure that we say that. With that also being said, Russ, you made a comment about Uncle Andy, as we like to call you in the community. Yes. There you go. Favorite dish. Y'all heard that. I hope you got that on camera. With that being said, I do want to publicly, I like to give people their flowers, especially when somebody gives me a mic. But I do want to publicly say to our governor, Andy Beshear, thank you for your partnership. Before you could even see steel out here, and as we go along with this, without you, we couldn't make this happen. So I do want to make sure that I do say that publicly. Yes. Now, we are here to celebrate construction, which is a huge part of this. We are at a turning point where we're getting ready to close in the building. I've got some folks that are going to explain to you what next steps happen. But I do want to bring up to you, and I wrote it down because I do not want to mess up anybody's title. So Ms. Sonia Watson, she's the Vice President of Economic Inclusion for Harmon Messer Construction. She's going to come up here and give you a little more detail about the work that our awesome construction team has done. I know you guys are probably tired of seeing me on site. I come to say hi all the time. Can't help you do anything, maybe put a nail in or hold something for you. But I appreciate all the work that you are doing, and Sonia's going to give us a little more detail about that, okay?
We are so honored to be here in the celebration of this great hospital, but also we want to recognize that this is Construction Inclusion Week. What does that mean? Construction Inclusion Week is a week dedicated to raising awareness and enhancing diversity, equity, and inclusion, specifically in the construction industry. And today is Supplier Diversity Day, and it's such an honor to be here today. So, we have been very intentional about making sure that those who are interested in being a part of this project have access and opportunity, and that we are in a space where we are preparing others for the future. We've held a series of outreach events where we have connected the community. We have paired contractors with each other in this industry. We have also had more than 200 individuals who are part of the construction on the Norton West Louisville Hospital so far, and we know that that number will continue to grow. Many individuals who are part of the West Louisville community have already been a part and on site of this team, helping us to make this hospital a reality. We cannot thank you all enough for what you have done, from preparing the site, to pouring the concrete, to securing the property, providing the sanitation, providing the portlets. Where's Portia? Thank you, Portia. I just want to share a quick story about Portia. Portia came to one of our first outreach events, And her goal and intention was she wanted to have her portalettes on this project, and that is what she's doing. She is providing an awesome job, and that's the example of what we're trying to do on this project. We're trying to provide opportunity, we're trying to level the playing field, and we're trying to give access. So thank you. Another initiative that's very important is we're not just providing opportunities for construction, but we're also providing the opportunity to change people's lives. And that is through providing careers, not just a job, but a career. And we are doing that through an initiative, a Harmon Messer initiative that we call UDI. It's the Urban Workforce Development Initiative. And this initiative has been a vital part of where we are today. So what this initiative does is takes local residents who are interested in wanting a career in construction. It provides them the hands-on training that they need to learn a skill, a trade, and then it also provides wraparound services to remove any barriers that are going to impede them from being successful. And so we're very proud of this initiative. We're working with this initiative in conjunction with the Louisville Urban League and Kentuckiana Builds program. So thank you for your partnership and your collaboration. And as I said, we've already had several individuals who are going through this program, and folks are telling us that this work that we're doing is transformational. And that is a great description of this project. With placing the final beam at the hospital today, the transformation continues at 28th Street and Broadway. The slab flooring will soon be complete. The exterior will begin to go up, and then the roof will be in place. All this will lead to the hospital being complete. It said 24, but I'm going to say very soon. It's been an honor to be a part of this project, and we know it's already having a positive impact on people, and it will continue to have a positive impact on people in the future. So with that, thank you. I would like to introduce our very own Anthony Mathis with Norton. He is the System Director of Sustainability and Supplier Diversity.
This is a very unique and special team that's been assembled to design and build this Norton West Louisville Hospital. So the collaborative effort continues, and the intentionality behind this group to ensure that we maximize our minority participation and community involvement has been and will continue to be vital in making this an inclusive and equitable project for our community. And I do want to recognize this team that's bringing this dream to a reality. So please stand as I call you, your firm's name. Please stand so you can be recognized. We're starting with the CM team of Harmon Messer. Please stand. We have our architect, 2019 AIA Architectural Firm of the Year, Moody Nolan. They're collaborating with our own local architect, CL Architecture, Carrie Anderson. Also on our team, we have 7 p.m., who is reporting and our boots on the ground liaison, 7 p.m. We also have on our team One West, and One West is running our plan room and helping subcontractors with their bid documents and billings. And NTC rounds out our team, and NTC is helping us with second chance workers to be involved in this project. So a lot of the flaggers that you've seen helping you in, those are all second chance workers employed by NTC. And now, if you're a contractor working on this project, would you please stand just so that we can recognize and say thank you? You must be out in the field still working. But anyway, I now would like to take this time to ask the Norton Design and Construction team if they please come forward. And just to keep things moving along as they're gathering themselves over there, this project we know, and our team knows that It's been of utmost importance to all of us because we understand that access to quality health care can impact and uplift a community. We understand that equitable health care is a necessity, not a privilege. We've heard it's not possible. It doesn't make sense. No one's going to put a hospital west of 9th Street. But today we stand on Norton Goodwill Opportunity Campus watching the construction and the vision of this Norton West Louisville Hospital come to fruition. And one person who believed this vision was Jessica Barr. She was a senior project manager on our team and was instrumental in getting us to this point. She was special to all of us and will forever be a part of the Norton family. And today, Jessica's family's here with us today, and I'd like to ask you to just come and step forward here, please. Norton Healthcare presents this plaque in remembrance of Jessica Barr for her compassion and service. She's helped build a corner of hope in West Louisville and other locations of care across our community. We honor her memory, kind heart, and joy of helping others. We thank you, and we want you to know that on behalf of our team, we present this plaque to you in honor of Jessica and all that she meant to our team, and she will be missed every day.
John, you're going to be the guy who gives the thumbs up today.
1, 2, 3.
Thumbs up, John. We'll get this beam waiting.